Okay, Alex, thank you so much, Alex McClelland. Thank you so much for joining us today. So what we're doing is just talking about the chapter that you wrote for Sick of the System. And the first question I have is very simple. Why did you write the chapter? What was the drive behind the chapter? What was the impetus?
I've done a lot of research on the criminalization of HIV in Canada. Canada is a leading country in the world for criminalizing people living with HIV in certain circumstances, usually when they are alleged to have not disclosed their HIV status to a partner.
Mhm.
Things are changing. The legal landscape is being reformed over time, but it's still an issue. I've done qualitative research on people's firsthand experiences of the criminal justice system, interacting with police, interacting with prisons, being incarcerated, ending up on the sex offender registry because they're usually were charged with aggravated sexual assault. In most of the cases, HIV was not transmitted, and it actually had nothing or little to do with the management of the
Ah,
prevention of HIV.
yeah.
It was just another way to criminalize people, and
Mhm.
that form of criminalization disproportionately impacted Indigenous people, Black people in Canada, newcomers from other countries, gay men, and people living in poverty. So just another way that we see the disproportionate impacts of the criminal justice system causing violence in marginalized people's lives, or actually causing marginalization, causing
Mhm.
oppression.
Mhm.
And so when COVID came about, I was quite concerned because I've studied this form of criminalization and also the ways in which public health officials or public health institutions work and collaborate with police to enforce certain public health measures.
Yes.
Um, and I've seen the harms of the criminal justice system, talking to people firsthand about the violence of criminalization. You really see how terrible and how awful it is in people's lives. And so I've looked at the ways in which public health collaborate with police, and how challenging it is, and how it ruins people's lives, and how coercive forms of public health target specific populations, make them subject to forms of intense surveillance, and cause violence in their lives. Um, and so I was concerned when COVID came about that the same kind of patterns of oppression from the criminal justice system in forms of policing would be enacted through coercive public health measures like
Sure.
fines or
Mhm.
charges, or the ways in which there was a massive scale up of police, and police were positioned as central actors in the response to COVID right
Yes.
away. They
Yes.
were out there on the streets. We saw, like you'd see,
Mhm.
I think remember seeing one of the COVID concerts of pop stars, and they were like thanking police officers and
Mhm.
nurses and frontline workers, um, and police officer collaborations with public health were also championed as kind of a
Mhm.
solution to the response. And I was extremely concerned about that. My chapter is called "We Can't Police Our Way Out of a Pandemic,"
Yes.
and I kind of trace the history of the problem of trying to police or um, criminalize people in the context of a pandemic, and also use coercive forms of enforcement to manage a collective public health issue, or a
So,
collective community health issue. So I was
so
concerned about that and wrote this
Mhm.
chapter for that,
Yeah,
to address that
no,
issue.
that's great. Thank you. That's very clarifying. So just to follow up, so then do you think the danger of tracking people who are COVID positive is mainly related to police, or are there other potential dangers to tracking people who are COVID positive? Or is it
Well,
really just related to the criminalization and the coercive aspect of the police?
yeah, there's other places in the world that have done the tracking of people. Like
Mhm.
we might have to, in the context of, or we do have to, in the context of a pandemic, rely on things like contact tracing,
Yes.
and keeping track of people and doing forms of surveillance. But that can be done in ways that don't involve the police, and
Yes.
don't involve
Yes.
coercion, and
Yeah.
don't involve fines. So in Canada,
Mhm.
in certain provinces in Canada, the provinces have enacted massive fines for people who are being alleged to violate social distancing rules. So
Mhm.
Ontario, Quebec, and Nova Scotia collectively have the most fines. Other provinces haven't. Like BC hasn't enacted any fines, Winnipeg
Mhm.
hasn't enacted any fines, and they've been able to flatten the curve. or Manitoba hasn't, sorry, not Winnipeg, Manitoba. But in Quebec, Ontario, and Nova Scotia combined have over 10,000 people who've been fined. And that's totaled, we've done through the project I do, policing the pandemic mapping project, where we are kind of documenting this phenomenon. We've found that that's over $13 million in fines that people have received. And we've heard stories of street-involved people, homeless people being fined in public for not social distancing, where they have nowhere else to go. And in Ontario, receiving an $880 fine. And the evidence that fines actually work is very, it's shoddy. It's not actually there. In other instances, like as a criminologist, we don't have solid data that fines actually work for even speeding. And if you increase the fine, it shows that it doesn't actually impact whether people speed or not. And so in the context of a pandemic where we've never actually had police forcing or enforcing how close you are to someone, all of a sudden enacting a disproven or unproven measure of a fine to deter behavior that we don't want. And then putting that in a system on people who already disproportionately target marginalized people, these fines and have targeted marginalized people, and it just will cause more harm, more uncertainty, more precarity for people who already might not be able to aren't on a good financial footing. So like, think about it. We have more police out on the streets, more bylaw officers out on the streets who can enact more power than they've ever been able to. And at the same time, the only people who are able to stay home are people who have the luxury to stay home. There's many people out in the world working in the front lines, people of color who are delivery workers, who live in precarity in the gig economy, who are work in long-term care facilities. Those people have to be out in the world. So they're simultaneously facing the onslaught of COVID and the onslaught of enforcing COVID. So we'll be at a heightened risk or have been at a heightened risk for this target of this like ramp up of enforcement. And so that was my concern, that enforcement is just going to cause more precarity in people's lives, more violence, more uncertainty. And we need to reshift our focus and think about new ways of tackling or handling a pandemic that do not involve the police.
Just to follow up, because you mentioned the tracking of the police in your chapter with you're working with your PhD student, Alex Lacombe. Is there anything else to update from that? I mean, because that you wrote that, I guess, in April, or you submitted in April, so things have changed a bit. Is there anything else that's interesting to update?
Well, Alex is a PhD student at the University of Ottawa, and University of Toronto, and we collaborate. So he's not my PhD student,
we
collaborate. And I'm now at Carleton University at the Institute of Criminology and Criminal Justice, and he's at the Socio-Legal Studies Department at the University of Toronto. And we've been tracking on our map on policingthepandemic.ca enforcement incidents. We basically comb the internet for reports from media or also government about how many tickets they're giving out, what kinds of enforcement are happening in relation to COVID, because we wanted to kind of understand the pattern of this. And we've seen criminal charges enacted. We just released a report last week highlighting that 43 people across Canada have received criminal charges in relation to COVID, most often in the context of an arrest by police where they're alleged to have spit or coughed at a police officer in the context of an arrest for something else. And we've seen similar things in the past.
Coughing can get you a charge.
Coughing can get you a charge of assault. Someone was charged with aggravated assault as well. But we've seen similar things with HIV in the past where police have alleged that someone living with HIV has spat at them and then they charged them with assault. And so in that context, COVID is very different. COVID, you could transmit COVID by coughing. You can't transmit COVID by HIV through spitting. You can't at all. But we know that police are not public health professionals, and police aren't trained in understanding the nuances of disease transmission. This is not their expertise. And often what happens with HIV, what we've seen in the past, is they use the specter of the fear of communicable disease to justify forms of force in an
Yes.
arrest. So 2 years ago in downtown Toronto, police thought that a man was living with HIV and he was causing a disturbance, so they pushed his face down into the cement, their knees on his back and his head, and they tasered him multiple times, saying to onlookers, he has HIV, watch out. So when we see police doing that kind of thing in the context of COVID, we'll know that they probably will use COVID as a justification for forms of force and violence, which we're kind of concerned about. We've also seen kind of a shifting of forms of enforcement across Canada. So initially it was really an individualized thing where people would receive a ticket for allegedly not social distancing or being in a park when they weren't supposed to be there, or being in a group of people. And this was something like in Montreal, you'd see Haitian young people in North Montreal who are playing basketball receive tons and tons of tickets, and then white kids in other parts of the city not receiving tickets. A classic, just kind of disproportionate way that the police enact racialized violence on people on their daily lives, and just using this in a new way to do that. You're using COVID as a justification for doing that. But now I think there's been quite a lot of scrutiny on the tickets, and people are going to the COVID related tickets and people are contesting them, and there's kind of a movement to respond to them. And as things have opened up into phase 2 and phase 3 of COVID opening up, the way that enforcement is happening is different. So now there's mask regulations. Most places have mask rules, and not individuals who are being targeted anymore. It's businesses. So if you don't wear a mask in a business, the business could receive a fine. And so there's kind of a shifting in the way that things are happening as things open up, which is something we're keeping track of on our map, which if I wrote the chapter now, I would kind of talk about the ways that things have shifted.
You predicted my next and last question, which is what would you update, or what would you change, or would you subtract anything? Would you add anything now that things have, a few months have passed since you submitted the chapter?
I mean, it was really fascinating to be part of a book that was developed so quickly, and I think it was really excellent and awesome. It was a wonderful process, and I'm really glad that it happened. I don't think I would change anything. I think my chapter is really about looking back to history in Canada. And even like I have a discussion of venereal disease regulations around the World War I, and how those targeted primarily Indigenous women. And so we can see over the course of history that laws that are designed to target people with communicable disease are used in ways to enact ongoing colonization and forms of racial injustice. So I don't know if I would change anything there. I think I could maybe talk a little bit more about the current context. And I think one of the things that is also interesting in terms of enforcement that's very big in Canada are snitch lines. And so police and municipalities have enacted a whole bunch of snitch lines, and we're tracking those on our map on policing the pandemic. And Ontario is interestingly the kind of hotspot for the most amount of snitch lines of anywhere in Canada, asking people to report on their neighbors. And I think that this is an interesting thing for people to reflect on. The culture of snitching that has kind of come about, or that was just there under the surface already, or was just blatantly there, that has kind of really kind of reinforced itself under COVID, is something that I think Canada has to contend with, because there's a whole bunch of reasons why it's a problem, but one of them is the idea that you can call the police on your neighbor because you think they're not social distancing. That's a solution to dealing with a collective problem, is blaming one individual person and individualizing the response, instead of questioning, why wasn't testing rolled out more effectively? Why are people on the street and not in hotels and in homes? And why is there an ongoing opioid crisis, an overdose crisis? Why is there an ongoing homelessness crisis in Canada? As opposed to, I can just call the police on this person who's in front of my street or in front of my house and isn't social distancing, and that's the solution. And so I think that was the other part of my chapter, is kind of reposition. Policing puts us in a position where we think we can blame one individual person, give them a punishment and lock them up, and that's going to be a solution. And as we've seen, since the book has been published, there has been a massive, powerful racial justice movement that's emerged out of the Black Lives Matter movement in the US and then in Canada due to the murder of Black people and Indigenous people by police. And that's kind of created a public conversation about the abolition of police more generally and the defunding of police more generally, which is part of what my chapter was connected to and speaks to in the context of the pandemic. So. Yeah.
Wow. Well, that's thank you, Alex. That really helps animate the words in the chapter, and actually gives us even more food for thought, especially what you ended with about the Black Lives Matter and the individualization of I guess of people who have the virus and the criminalization of those subjects. So thank you so much,
Thank you.
Alex.
Thanks for having me.
Yeah.
I appreciate it.
Okay. Stay safe. Yeah.
Yeah, you too.